Hello, good afternoon, everybody. My name is Kelly Condon, and I am the Program Coordinator for the Texas Oncology Foundation. Thank you all for joining us for today's webinar presentation. We are excited to have Nicole Hodak with us today, and she is going to be leading our discussion on nutrition-related management of treatment side effects. Before I pass it off to her, I just want to introduce a little bit about our foundation. So the Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. Programs like this, symposiums, along with community support groups in a few places, are just some of the ways that we help provide resources and just encouragement along the way for all of those on the cancer journey. We also want to thank Texas Oncology for their continuous support and partnership of these programs. And lastly, I just want to go over some housekeeping things for you. That way, if you're experiencing any trouble, such as your window disappears or the slides don't seem to be advancing, we've found that simply closing and reopening the webinar window will fix this issue for you. If you're experiencing problems with the audio at all throughout this presentation, the best solution is to call in and listen over the phone. You should all have a control panel that popped up when you joined this call, and you can select phone call, and then that will access a number for you to dial in on. Throughout this presentation, there are going to be a few poll questions. And so when these show up on your screen, simply select your answer. The presentation will continue after answers have all been submitted. So we're going to practice this. And one thing that we like to find out is just who do we have on the call with us today. So let us know if you are a survivor, a caregiver, a healthcare provider, maybe you're a healthcare professional and a survivor, or if you're something else, let us know. And we're going to give you a few minutes to respond. And by minutes, I mean seconds. Awesome. And then what is also really cool is I get to share our results with everybody. So now you see on your screen that we have half and half caregivers and healthcare professionals. And so that's really awesome. Thank you all for being here today. If you have questions for Nicole Hodak during this presentation, please send them in to us. We want to know your thoughts. We want to know your questions. We're not going to answer them right away. We are going to respond to them after she is done presenting. To send us your questions, going back to that control panel, there's a questions tab. And if you click on that, it'll open up for you. And you can send in any thoughts, any questions that you have throughout this entire presentation. And again, like I said, at the very end, we will have a Q&A time. Lastly, this webinar is being recorded, and the online archive will be available for viewing after this live version. The recording will be sent to everyone who registered for this in a follow-up email, and will also be available on our Texas Oncology Foundation website. And that website is texasoncologyfoundation.org. And if you find our programs tab along the top, then you will see Survive and Thrive Webinar Archive, and that is where you can view this webinar and all of our past presentations as well. Like I said earlier, we are excited to have Nicole Hodak here with us today. She is a board-certified oncology dietitian. You might know her if you are up in our Texas Oncology Baylor Sammons Cancer Center. That is where she is officing out of. And she has just been a constant part of our Survive and Thrive symposiums. She has a passion for patient care, and it is evident every time that we get to listen and learn from her. So Nicole, thank you so much for being here today, and we are excited to hear from you.
Thank you so much, Kelly. And thanks again, of course, to the Foundation as well for inviting me back this year to provide another webinar on nutrition. The topic that I get to cover today is something that's really important to me because not only is it something that I do daily in the clinic, but also, when we're out with the Survive and Thrive symposiums, a lot of times I meet people that say, I really wish we had a dietitian in our clinic, or maybe I really wish I had somebody to kind of guide me through just nutrition in general, or spend a little bit more time on some things that were happening that maybe nutrition could have helped. So, and we also know too, I think we've seen in the literature that some of these symptoms in particular, things like taste changes and so forth, that, they carry a big burden for patients. And when they're communicated, maybe they're not addressed in as great of detail in the clinic. So providing some alternate strategies and also just kind of imploring patients to communicate these with a little bit more, a little bit more weight. I think that's definitely worthwhile. So here is hopefully a little bit of gap closing today. So we'll cover the implications of nutrition impact symptoms, and those symptoms listed here, of course, nausea, vomiting, mucositis, taste alterations, lack of energy, poor or loss of appetite are all here. And I included both, the clinical name as well as what we might commonly call them. So that way, if you're ever looking for more detailed information or information from a reputable source, you might actually see them being called something a little bit different. And then I will wrap up with what I call a measure of harmony for my final thoughts and resources. So what is adequate nutrition? I think as human beings, we really like to put things in categories, particularly when it comes to nutrition, or as I like to think of them as boxes. We talk about things from a healthy versus unhealthy perspective, good versus bad, eat this versus not that. And as a society, those definitions or the definitions that we create about those boxes are often determined by things like body image, but also social, impressions. But rarely are those definitions, and I shouldn't say rarely, but less often we know that they're defined by disease prevention and cure. And we also see that in the literature when someone does, carry a diagnosis of cancer of any kind. We find that people really want to institute one type of diet or another. But as health professionals, what we would define adequate nutrition as is the following things. We see things like weight stability, immune health, mental health, and then this overall reduction of disease risks as being of great importance, because we know that when someone does carry a diagnosis, when we talk about survivorship, that unfortunately does not lift the burden for other things like heart disease and diabetes. And as we talk about these symptoms, it's fundamentally important to understand that nutrition or adequate nutrition is really essential and life sustaining, because without it, we can have some really deleterious impact. So when someone does go through treatment, there are a myriad of symptoms or side effects that tend to occur, a number of which I have included in this funnel here. And they tend to impact oral intake, so how well someone is getting that adequate nutrition. But even more importantly, or perhaps unfortunately rather, that reduced oral intake can sometimes feed back into some of these symptoms, and some of these symptoms can feed into one another. So for example, I might receive a referral for someone who has nausea and vomiting and need help with their nutrition. And sometimes when I go into that consultation, I may find that not only do they have nausea and vomiting, but they might be in a great deal of pain and taking pain medications, which can cause constipation. They may be taking, anti-nausea medications, which can cause constipation. And constipation in and of itself can reduce someone's appetite. And so all of these things are just giving a cyclical kind of impact or burden on their overall status as they tend to lend into one another again and again. So you might say, well, treatment is only in the short term, or as many of my patients will often say to me, well, I'm overweight and can stand to lose a few pounds. But we know that even in a short period of time, when someone is constantly depleting their nutrition stores, we start to run the risk of a number of different things. And so I bring you your first poll. Good nutrition is important through treatment for which of the following? Right. And so I can see that most of you all of you actually answered correctly, as I hoped you would. 100% of you said all of the above, so that's correct. When we look at the literature on how nutrition impacts these outcomes, we think about things like bone health, quality of life, strength, ability to remain in treatment, and we continue to see that nutrition strategies or interventions bear great significance. And the truth is that weight loss and poor oral intake, while someone is receiving treatment, can actually make the toxicity or the burden of some of the symptoms and side effects even greater. And when that happens, our medical team may have to reduce maybe the dose of that treatment. Sometimes we just have to stop that treatment altogether and do something different. Sometimes we find that people end up being hospitalized. And so that really can get in the way of a well-planned approach for a person's cancer. So we really want to make sure, that's another reason why we want to really provide a good foundation with nutrition. But moreover, survivorship can be greatly impacted. And so I have a number of different things that we get concerned about when someone goes through treatment, particularly when their nutrition was not adequate. And so we think about things like kidney function, especially when someone's not hydrating well, their bone health, if they're just not getting enough nutrition in general, heart health, strength, endurance, quality of life, and just overall survival. So we want to make sure that nutrition it carries of great importance when it's being communicated to our patients, because it's no small thing when it comes to even just a short period of time through that treatment, because our nutrition needs are daily. They're pretty constant, as we have some nutrients that are, we don't actually store them in the body, so we need to keep providing them. So a lot of people, when they think about treatment, be it chemotherapy, or less often, I think people think about radiation as being, as causing nausea and vomiting, but a number of these treatments do cause nausea and vomiting. And I would say that's probably the most common symptom that people tend to think about, but it does depend on the type and the dose of the treatment that they are getting. But there are a few types of nausea, and sometimes people will be a little bit kind of miffed as to why they are having nausea and vomiting, maybe 3 days later after, let's say, chemotherapy, because there are different types. And so it's important to communicate that with your medical team so that way they can really help. If someone's not able to eat and drink, obviously that's definitely going to get in the way of their nutrition, and more importantly, hydration balance. So a lot of times we see hospitalizations are because someone had so much nausea and vomiting they just couldn't keep their liquids down, or maybe they weren't hydrating adequately. So the first thing that we do in nutrition is we focus on meal timing. So with the use of nausea medications, I'll always ask my patients to time the meals around the schedule of those meds. So if they're taking them every 6 hours, making sure that they have a meal scheduled within 30 minutes of taking that drug can be helpful in keeping in or keeping down that meal. And if someone is actively vomiting, certainly we would ask them to stop eating for maybe an hour or two, and then try and resume some liquids. That's where we want to start with that. And it's also important that we think about liquids not just in the frame of mind of water. So we need to rehydrate, because when we vomit, a lot of times there are electrolyte losses or disturbances. And so the rehydration recommendations come in the form of things like Pedialyte, which is really gentle on the gut, as opposed to like a full Gatorade, or G2, popsicles. Some people will do, like a chicken broth, because there's a little bit of sodium in there, and that can be helpful. And with that, when someone is able to keep the clear liquids down after, they've given a little bit of rest, then we can move from there onto what we would consider to be a full liquid diet, which would be more of your creamier liquids, like, a pudding, or perhaps a creamier soup, that sort of thing. And then once that goes well, then we move on to what we would consider to be a regular diet. If not, then of course we just kind of start that process over again. When we reinstitute that regular diet, we want those foods to be a little bit more bland. So we don't want them to be overly greasy or overly sweet. And some of those bland or dry foods that we would consider to be helpful would be something like saltines or soda crackers, cereal, and toast. And these foods are particularly helpful, your saltines or your soda crackers first thing kind of in the morning and then consistently throughout the day. So just doing really small bites of things, because a big meal can be very burdening for someone who's really struggling with this symptom. And an empty stomach will actually aggravate nausea further. A lot of times I'll encounter a patient that is just not doing anything at all, and that, like I said, can just lead back into that cyclical scenario. Ginger, if you haven't heard, is nature's antiemetic tool. And so I recommend my patients to just actually buy the ginger root and then slice it. They can put it in boiling water and make a tea out of it. And that's actually helpful if they're taking nausea medications. They can actually sip on that as they're taking that medication. Some people will add lemon or honey for a flavor, addition to that, and that can be helpful there. And then good oral care, because after someone is having trouble with this symptom, not only does it leave a bad taste in that person's mouth, but making sure that we're taking care of our dental health, because the acids that are associated with that can be problematic. Mouth sores or mucositis is difficult for the obvious reason that it just hurts to eat and drink. And again, certain treatment, drugs, radiation, and stem cell transplants are all causes of this symptom. And we know that our mucosal cells turn over about every 7 to 14 days. So that's about how long it takes after treatment has stopped to start turning over and healing. And so when someone is going through treatment, it could be anywhere from 2 to 4 weeks, depending on the type of treatment and the number of doses that someone receives before we start to see any relief. And in terms of nutrition, that can be a long time. So what we do here is really great oral care first and foremost. So we see over and over in the literature that this is one of the best things to do for mucositis, is to provide a baking soda, salt, and water rinse. It actually helps to clear the debris. It provides good pH control for oral hygiene so we don't run into things like thrush. And again, it can just actually help to prevent and soothe as well the mouth sores that are present. And then obviously we want to avoid things that are going to make them hurt worse. So if we think about if you've ever had a mouth sore, or if you know someone that is, spicy, hot foods, rough or acidic foods, these are the foods that are going to be most irritating or most offensive to that scenario. So chili, hot wings, limes and lemons, foods that are high in vinegar like pickles and vinegar dressings, these are definitely foods that we want to avoid. And then when we look at supplements or other micronutrients that we think about that may be beneficial in preventing or controlling mucositis, the one that shows the greatest promise is glutamine, in particular with head and neck cancer treatment through chemoradiation, as well as lung cancer treatment with chemoradiation. Both of those actually have a general suggestion towards using glutamine. Glutamine, if you're not aware, is an amino acid, and the way in which this is done is through a powder. It's actually done through a swish and spit. For these with your stem cell transplants, it's actually cautioned against it, mostly because they've studied it in parenteral use and there were some adverse effects, and so there's just a lot of caution with that. I'll tell you, in the time that I've been working in the clinical arena, I've seen it in use and then I've seen it not in use. So glutamine is one of those things that just definitely talk to your physician about whether they're comfortable with it being used for prevention. And it's also worth mentioning that it takes great discipline to really see the benefit. So also, talking through with a patient, if you are a healthcare provider or a caregiver for that matter, since that's kind of our population today, just talking through with that person if that's something they really want to commit to, because it is 3 times a day, doing that swish and spit to actually even see the benefit from it. And other nutrients that have been studied include things like zinc, vitamin E, selenium, none of which have been able to show enough or even consistent results to even provide a recommendation on. But when it becomes, when we think about the foods to choose, it's really about comfort. And so we would say to do things like pureed foods, which are foods that have been blended or liquefied to make the physical process of eating less cumbersome. and getting in foods, again, that are soothing. So maybe frozen grapes or a frozen banana, or even frozen yogurt or fruit pops, things that are cool or cold or room temperature. Those can sometimes be a little more comforting, especially than foods that are warmer or hot. And then getting in, broths, gravies, and other non-spicy sauces can help in the sense of helping foods to be moist, because sometimes if it's really abrasive or dry, that can actually just create more discomfort. And fats and oils kind of can create that a little bit of a layer or a film, if you will, when things are difficult. And sometimes when someone is really struggling to maintain calories and protein, and perhaps their body weight is drifting on us, we may ask them to also put their attention to high protein foods and high calorie foods, so that way the volume that they have to chew or take in on a meal by meal basis is small, but we really just have packed in more nutrition for each one of those bites to make them count. Some other things to do are to tilt their head back and forth, so that way they don't have to do a whole lot of oral manipulation of those foods, just to kind of get that, to the back of the mouth. Some people will use a straw. And then again, that bland rinse that I mentioned earlier is really helpful, aside from the things like pH and that sort of thing, but it can help with pain. Cryotherapy is an approach used actually down when somebody is in chemotherapy infusion. It's to be started at the beginning and continued beyond, but it's where someone would hold ice chips in their mouth throughout that treatment. And the thought is to kind of create some vasoconstriction, so that way we don't have a whole lot of, chemo getting access to those tissues in the mouth. So cryotherapy is another approach being used. And then, of course, oral pain management. So talk to your physicians, because if it's getting in the way of your nutrition, it's going to get in the way of all of those other things that we talked about. And there are, mouth rinses potentially that could be prescribed for that patient, or even just general pain management that can be done. Taste changes is so poorly understood that there really isn't a lot of evidence-based information on this topic. However, many patients experience taste changes, and it does greatly impact someone's nutrition when they find foods to be so off-putting or even just disappointing. And there are other factors to add to this that do influence taste. So sometimes we may find that someone is a smoker, or they're of an older age, and maybe they just have some nutrient deficiencies, poor dental hygiene. Maybe they've had a surgical procedure that has impacted, maybe some salivary glands, that sort of thing. And so taste changes can be a little bit of a difficult thing to navigate, particularly in the literature. But what we do know is that, again, those taste buds, we used to think that there was kind of this taste map where you had salty and sweet on the front, and sweet or sour, on the sides, and bitter in the back. And we're finding that that's actually not true. So that's not particularly helpful when we map out just how to, kind of come over taste changes for a patient. But we do know that some of these treatments can decrease the number of cells that we do have. It can alter the cells themselves, or maybe it's just like a neural coding disruption in how taste is being perceived. But these are the 5 taste senses. And so that's what we really work with as far as nutrition goes, in controlling some of the sensations that we're getting to. So the first thing, again, is good oral care. And you can kind of see that that's a big theme throughout here, but making sure that we are still doing some brushing and rinsing before a meal, as well as after meals, as far as a basic rinse goes. Because if someone has a bad taste in their mouth after a meal, we definitely want to encourage them to rinse. So that way the duration between that meal and the next meal is not elongated by, their dissatisfaction with the last meal. Zinc is something that it has been studied and continues to be studied, but unfortunately we don't have any randomized trials to really look at the difference between, taking a zinc supplement with a placebo. So we really don't have a clear answer on that at this point. So again, if that's something you're interested in doing, definitely communicate that with your healthcare team. But what we do is provide diet modification. And so there are a number of sensations that people get. So I always ask my patients, describe to me what it is that you're tasting when you do taste foods. And so sometimes it's metallic, sometimes it's just off-putting, sometimes it's overly sweet. But for metallic, the first thing we ask them to do is to cut out the metal flatware and drinkware, just because that can kind of funnel back and keep contributing to that metallic taste they're getting. We ask them to use sweet and acids to help flavor foods. Meat is probably the most offensive for patients when they're having a metallic taste in their mouth. And so if, some of the alternate sources of protein, being eggs, dairy, beans, tofu, and soy, are not something that they're really able to comfortably work in, we talk about how do we create or take flavor to kind of cut through some of that metallic taste. And so I might ask them to marinate their meat, make sure they're scoring it so that they have better surface area coverage of the marinade that they're using for that meat, so for that flavor penetration. And so the things that we would ask them to use are, like I said, sweet and acids, but it'll be things like fruit juice or maybe wine and Italian dressing. And so some examples of that might be if you're adding fruit or fruit juices or fruit itself, maybe it's an apple glazed pork or perhaps a maple mustard salmon or orange chicken, because that way we're adding a little bit of sweet and sour and an acid to that may be helpful. Now, naturally, if somebody has mouth sores in addition to this, again, we're talking about layers here. So the acidic part of that may not be something that they can really use. And so we just do maybe more of that sweet. So maybe the apple glazed pork might just be something that's best used for them. Loss of taste, we ask them to just elevate the flavor. So sometimes people will say, I just don't taste anything. And when there are multiple people in the household, I will ask those individuals to consider adding their herbs and seasonings maybe at the end of the meal. It just depends on how it's going in the household, just because sometimes you will find that a spouse might say, oh my gosh, our food is just so incredibly intense because he can't taste anything. So that's one thing that people will do, is consider adding the flavor at the end if it's an herb and a spice. And a little bit of salt. A little bit of salt can go a long way, because salt is what we use to bring out the flavor. We've long used that in culinary. Trying fresh fruits and vegetables, because they may be more appealing than the canned and frozen variety. That also applies to that metallic taste, or when things are just off. And if things are too sweet, we ask them to cut that sweetness by diluting that food or drink. Ensure is one of those examples. So if someone is using some type of oral nutrition supplement, like a shake, for example, they may say that it's just really too sweet, and that's one way that they can help cut down on that, is by just diluting it. And when foods are just off, it may be best to start with things that are a little bit more bland, that don't have such a strong flavor. So maybe a bread or rice and potatoes, that actually may be beneficial there. And when smells are unpleasant, which olfaction, or our sense of smell, plays into the way we taste things. So if smells are really strong and off-putting before someone even gets to that meal, that can be a problem. So having meals prepared outside of the home, or just being away from the meals when they're being prepared, can be greatly helpful, or just keeping foods that don't really give off a whole lot of odor. So things that can be prepared at room temperature, or things that are maybe cooler, can be helpful. And of course, making sure that the spaces are ventilated. And I've even had people, I've just told them to put a lid on it and put a straw in it, so that way it is just, there's not a whole lot of tasting going on. It's really just a quicker delivery of that nutrition. Rebecca Katz, she's a chef that has done a lot of training actually with dietitians on taste changes, but she actually has a Power of Yum blog, and she does webinars that you can do. You can do trainings through there, or you can just read along with her blog, and she has recipes that are also available. But she has this FAST technique, and that's fat, acid, salt, and sweet, and it's about how those different components work in food. And so, for example, she tends to really favor grade B maple syrups when it comes to using a sweet ingredient to come or cut through something. So for example, if something's really metallic, she would recommend that and then maybe some lemon. Or if something's really sweet, she recommends that, you use 6 drops of lemon juice, to start. So if for some reason a sauce is just too sweet, that's what a person could do at their plate or even in that whole pot of preparation. And so those are just some great examples from her. The next symptom that we'll cover is very common, and so this is a good time for another poll. A person with fatigue should not do which of the following? Rest more, drink coffee, physical activity, eat more, or take an iron supplement. All right, so it's pretty divided here. And truth be told, the answer intended here is take an iron supplement because the rest of these things can prove to be beneficial with some restrictions or limitations. But I'll just touch on the iron supplement really quickly. A lot of times, a treatment can have an impact on someone's blood counts. And so when a patient will see that they have a low hemoglobin and low hematocrit, they automatically think iron and think, well, if I take an iron supplement, that will surely help with that, and maybe I won't be so fatigued. If the physician then finds or suspects rather that someone is iron deficient, they can run a panel and determine whether that person is deficient. And in that case, the iron supplement may help a little bit with the fatigue, but it's not necessarily going to, taking an iron supplement when you do not have an iron deficiency will not have an impact on fatigue. And more importantly, iron is considered to be a heavy metal and can actually be pretty detrimental when taking it above and beyond someone's needs. And it's also constipating, which goes back to all those symptoms that we talked about earlier. But let's talk about some of these other factors. It is multifactorial, so a lot of times we do control some of these factors or of these risk factors, and that can help with the fatigue, and we'll talk especially about some nutrition related strategies, but these are things that play into fatigue. Fatigue is experienced by a large number of patients, and it is very common with chemotherapy, radiation, stem cell transplants, with cancer treatment in general. So it is a very unfortunate side effect. But there are other things that can contribute to that or make these things worse after someone does have a diagnosis. So things like pain and narcotics, psychosocial, physical stressors, infection, all of these things can really add to that. So communicating your fatigue levels, even though it is a common side effect, it's important to know that there may be some other things that are contributing to the symptom. So the first thing we think about is energy conservation and activity management. So I see that some people said rest more for something that you don't want to do. Certainly because of the fatigue, we do want someone to rest, but along those same lines, we absolutely do want them to be mobile. So making sure they're getting their physical activity in. And the recommendation for that is 30 minutes a day, and just basic walking is greatly beneficial. So a lot of times I think as a culture, when someone is ill and going through treatment, we just want them to rest. But sometimes, as long as it's safe, so someone is not dizzy, lightheaded, short of breath, feeling incredibly weak when they're physically active, if those things are not happening, they absolutely should be trying to engage in physical activity every day. And if someone is a little bit uncertain or needs a little bit of help, there are programs out there that can help with this. So Fit Steps is a really great program that a number of the Texas Oncology sites actually has and will make referrals to. And Livestrong is another program that's put on through the YMCA, and it includes a gym membership that can be very helpful for patients. And with all of this, we're trying to conserve a little bit of energy too, right? So we do know that we have increased needs when someone is going through treatment or carries a cancer diagnosis. And so we're really trying to make sure that we're balancing calories, protein, hydration, these micronutrients, maintaining body weight, within reason, and then making sure that we're just getting enough energy so that way that in and of itself is not contributing to the fatigue. But when it is present, using easy to prepare foods is paramount. So we want to do things like use the freezer for foods. If somebody prepares you, let's say, a big batch of soup, and you know you're not necessarily going to get through it all, and you're practicing good food safety, definitely use your freezer. So put that away so that way you can just kind of thaw things out and reheat it. And then using foods that are very convenient, like hard-cooked eggs. Fresh fruits and vegetables require absolutely no preparation. Dairy foods, bagels, rolls, beans, soups, tuna. Just think about the things that you can really pull quickly to prepare and consume that are not going to, create a whole lot of labor or discouragement from eating. And accept the help. I cannot say that enough. So if you have people that want to, like I said, bring over food or create a meal train for you from a church or a community, let them. And if financial constraints are a part of the equation, certainly think about something like Meals on Wheels. And if not, then there are other programs that are out there that actually will just kind of provide like par cooked or even fully cooked meals that can just be heated up pretty quickly. And then regulate caffeine intake. So that was another common answer that you shouldn't do. So someone can still drink coffee if they are a coffee drinker. Of course, we're always thinking about hydration when we think about caffeine intake. So caffeine intake being it from soda or coffee and teas. We just want to make sure that as the day continues on, we cut off the amount of caffeine that someone is taking in, because though that may help them to be feeling like they're staying awake, and even if someone is actually still able to go to sleep on time, they may not be sleeping as well. They may not be getting the actual rest that they could be getting out of the time that they're sleeping. So just making sure we cut off the caffeine intake, at about 3 p.m. is the goal there. And then omega-3 fatty acids. So there's some interesting literature that's out there in regards to fish oil supplements, as well as just omega-3 fatty acid intake. And we do see that it can have an impact on improving levels of fatigue for someone who's going through treatment. That said, it's safe up to 3 grams daily. But we do definitely want to make sure that our patients are talking to their physicians about whether they feel comfortable with them taking that, because it can pose a anticoagulation risk. So definitely communicate that to your physicians. And I will always, always, always advocate that a patient get their omega-3 fatty acid intake from foods first. So fish is an excellent way to get that. And then loss of appetite. It's really not well understood, but again, is so common. And again, these risk factors include sadness and depression, illness, infection, the treatments that are being provided, medications, constipation. There are a lot of things that can contribute to poor appetite or loss of it entirely. So what we do is we think about making the most out of each bite, right? So we would ask that person to do smaller and more frequent meals. So a person might do 3 meals and 3 small snacks, or they might do a couple of bites every half hour to 1 hour of the day, their waking hours, to make sure that they're getting in what they need. And the foods that they do eat, we're going to ask them to really focus on the greatest amount of calorie and nutrient density. So a small volume with a big benefit. And when we think about those foods, we think about things like nut butters, avocado, dried fruit itself, yogurt, cream cheese, mayo, that sort of thing. I have on here fortified milk. And what I'm really talking about here is something more like a double strength milk. Milk is predominantly water. And so if you take a quart of whole milk and add a cup of non-fat dried milk powder, which you'll actually find that a lot of times kind of in your baking area, that's where you'll find that. It was used a long time ago when we were kind of rationing food. It's very shelf stable, but you're just basically adding the dried milk powder that you would typically reconstitute with water, but instead you're adding it to the milk. And doing so, that 1 quart whole milk and 1 cup of the dried milk powder gives 4 servings. And in those 4 servings, you'd get about 210 calories and 14 grams of protein, which if you've ever looked at something like an Ensure or a Boost, that's right in line with those numbers, and you're getting it without a lot of other additives that can or cannot, may or may not be beneficial. And that kind of plays into this liquid calories piece. So sometimes drinking the calories is a little bit easier. It doesn't settle as heavily on someone, and they can just kind of sip on that through the day. So that's another way that we can really keep someone stable and make sure that they're getting adequate amount of nutrition when they really just don't have the appetite to kind of chew through, the monotony of a big meal. And then of course, moving our body again and again and again, because when we do move, we know that actually can increase someone's appetite. So making sure that we're moving, and then that can also help with good bowel regularity, which again, also helps with appetite. So here is kind of an example. I thought I'd include this here so I could show you what 3 meals and 3 snacks might look like. And it's pretty well balanced. So you can see at breakfast we have a half a cup of orange juice with just a slice of toast and a tablespoon of peanut butter. So that's pretty small. And someone may or may not be able to kind of get through that in one sitting, but we can add or take things away as we see fit. The dinner, I would say, is probably the largest meal of the day. And a lot of times that's a good place to put that, especially if there are other people around, just because that kind of social influence, someone may, if people are eating around them, they may actually be inclined to do a little better. Despite the portions being so small, for someone who doesn't have a great appetite, that may actually be a little bit much. And so some of that they may be able to move into, for example, that evening snack. So they could move like a half a cup of peaches into that evening snack with a cup of yogurt. But that'll just give you a little idea of how to kind of map that out. So for some final thoughts, I think of great importance is just finding that balance. I mentioned earlier, especially with things like taste changes and mouth sores, that a lot of these symptoms really present themselves in combinations. So I really just ask my patients to be very gentle with themselves. And I really tend to present kind of a hierarchy to patients. When things are going really, really well, certainly we want our diet to be more plant-based, fresh fruit, or not necessarily fresh, but fruits and vegetables and beans and whole grains and legumes and that sort of thing, and finding a good amount of protein every day because it is a nutrient we don't store in the body, and so on and so forth. But when someone is really experiencing the burden of some of these symptoms, getting something in over nothing at all is where we are. So if that person is really only able to eat a donut in that moment, that is okay. So, finding that balance there, and then meeting people where they are, especially with caregivers. It's a hard thing when caregivers are cooking all these things and nothing tastes right. And when they just feel like they're putting in 110% and they're just constantly asking that person to eat, but just kind of, like I said, being gentle with ourselves, the patient, and then also being gentle with others and know that you can do 110%, but our patients can only do what they can physically, what they're physically capable of. So just keep on supporting each other as best we can. And then being flexible and mobilizing support. So a lot of this stuff really requires us to recenter and refocus our thinking as far as being flexible, because these, eating is pretty intuitive for much of our lifetime. And then all of a sudden we have these things that come in and really require us to think a little bit differently about our nutrition. So we just need to be a little bit flexible there and then mobilize that support. So when you have a support system that's really looking to help you, use it. And then resources. So I mentioned earlier, or I guess actually Kelly did, that I'm a board certified oncology dietitian, and we have what we call a dietetic practice group. And so that's oncologynutrition.org. They actually have a tremendous amount of resources, really, really great question and answer section on things like flaxseed with certain types of cancer, does sugar feed cancer, that sort of thing. And then, of course, your American Cancer Society and the American Institute for Cancer Research. Those are excellent guidelines there for survivors, as well as cancer prevention. cancer recurrence, that sort of thing. So excellent resources there. And the American Institute for Cancer Research, if someone is not really struggling with a lot of symptoms, and in some cases, even if they are, they have great recipes. So for the holidays coming up, there are really good nutrition recipes that they provide there. And they also have programs where you can enlist to receive emails kind of on a weekly basis as like a challenge method. And then Rebecca Katz, that chef I mentioned earlier, that's her website there. There's ASCO, the National Cancer Institute. These are great organizations that provide a lot of guidelines for what we do, as well as this last one here, the Multinational Association of Supported Care in Cancer and International Society for Oral Oncology. They provide, and actually just updated the guidelines for things like mucositis and taste changes this year. So July and January, they just published their latest guidelines for the review of the literature. So those are all some really great resources. And that is all I have. So at this point, do we have any questions?
Hey, Nicole, thank you so much. I
Yes.
always enjoy getting to listen in on you presenting, so it's always a treat for me.
Thank you.
And yeah, like Nicole said, if you have questions, please utilize that questions tab. We've had a few, but please keep sending them in. Just, this is personal, but like one thing you said that I think is just so simple and so immediately that we could put into action, and I think it's just smart, is that high protein foods, and it's increasing the fullness and decreasing the time that we're actually having to spend in the energy. And so anyway, I just really liked that note, and it was so simple and so valuable to me.
Yeah, and protein is one of those nutrients that we hear a lot about when we talk about just someone who's not well, because we focus so heavily on it. But the reason is because we don't store protein. We can store fat in the body, we can store carbohydrates in the body, and people tend to think of our, let's say, our muscles as a storage form, but it's really not. And so when someone doesn't get that protein, they have to pull it from places like their muscles, and that's never a good thing. So yeah.
Yeah, and not even for, the patient, but kind of to that last point you had of just the caregivers, being flexible and kind of adjusting. That's, I feel like, an easy, or something that's, immediately applicable for them as well, is if things are running out, those high proteins is a good solution. So
Yeah,
it saves energy for everyone. We had another question, and it says, you just mentioned the thought about sugar feeds cancer. How is the best way to address this with those who are absolutely focused on this thought?
Yeah, so that's actually something that I get asked about a lot in the clinic, and it's really complex. So I'll just say, a lot of times I have to bring people to the thought that what we do know now is that you cannot necessarily starve a cancer cell from the sugar that it is using to metabolize to continue being in existence, and not also starve the healthy cells of our bodies. And so that's what's really, really challenging there. And so trying to get someone to think about feeding and nourishing their healthy cells. And when we talk about sugar, the reason sugar, a large part of the reason is that sugar is even in this question or even being brought up so frequently, is because we think of things like PET scans, but that's really not telling the whole story. So it's really just best to really focus on getting a very balanced diet. And sugar from an added source is also a big reason why we hear about this. So added sugar has the implication of excess calories, and we think about things like insulin resistance and so forth, where someone starts to have excess body weight, which is a big risk factor for cancer to start with. And so that's what we're really trying to get someone to think about, is where we are in the literature is not taking all of the sugar out of the diet, and it's also a big lifestyle change. It's a big quality of life implication in doing so. So trying to get someone to focus on the fact that there is no one single diet or restriction that can cause or cure cancer, I think, is probably the biggest drive home message that we really try and send to our patients.
Yeah, absolutely. So we went through a handful of side effects and symptoms that can come from treatments and ways that you can utilize nutrition to manage those symptoms after they've occurred. But are there any tips that you will give patients who are about to start treatment of just, here's some nutritional items that you can start adding now that might help lessen those symptoms that may occur? So I guess, are there any like preventative measures that you take ahead of time?
Unfortunately, I would say no. A lot of times I think you just mentioned in the question, a lot of times we just ask people to put things into the home. I will say being physically active, maintaining their body weight going into treatment. So I think sometimes I hear from patients, well, my doctor said I should gain weight going into treatment. And if someone's underweight, I certainly see that philosophy, but putting on weight so that way we can lose it is never really a good idea. And so just asking someone to really focus on maybe building up a little bit of endurance and stamina, being physically active, just making sure their nutrition is well balanced. So, following kind of those guidelines, the AICR.org, I talk a lot about those in the symposium, kind of getting good nutrition in place and then putting things on hand for maybe some of the trials that are expected to come. So that's really what I ask my patients to do, is kind of set things up that way. Eat well, do well, while you can right now prior to treatment starting. Make sure you're working in some physical activity, and then have the things on hand for the symptoms that we know are most common with the particular type of treatment you are going to receive.
Okay. And then a question that we actually got sent in before this presentation was, they have just heard that there are potential benefits of intermittent fasting and the ketogenic diet for cancer patients. And so can you just share any insight that you might have on those?
Yeah, so the literature is really in its infancy. Let's just say that. So we do see that there have been some studies that have shown benefit with things like platinum-based therapies for intermittent fasting, and actually it's really called short-term fasting, which is the other caveat to I think both of these that I should address. And I think I was trying to get at a little bit earlier, but we think of a ketogenic diet, and a lot of people kind of like in our social media and our friends and our family, they're talking about a keto diet that is not truly a keto diet. It's not necessarily how it's being studied. That's a very different thing. That's important to know. And then also with intermittent fasting, there's a myriad of different approaches. So it may be that we ask someone to fast 36 to 48 hours prior to a chemotherapy, and then 24 hours afterwards. And in the literature, you see that some of these approaches, very particular ones, have maybe shown some benefit on things like toxicity. So how burdening is that type of treatment? But what we don't have the clear picture for is, okay, so someone experienced less toxicity with that, but what are the long-term implications of that? So did that impact, the risk for recurrence for that cancer coming back? And so those are the kind of the questions that especially dietitians are kind of really juggling right now. So, I mean, I can lessen how awful this is potentially, if you have a platinum-based drug and do this kind of fasting prior to and afterwards, but, is that having an impact on how things go in the long run? So that's kind of where we are. So, where I am today, and this goes back to that low sugar question or no sugar or ketogenic question, is I don't put my weight behind any one of these diets, but sometimes we do have patients come in that are really, really convicted to do a certain type of thing. And so, my job is to present, maybe some hard literature for them and show them this is where we are, but with a clear understanding that this may really impact your quality of life. And also, it may not have any bearing on outcome. It may or may not. And so, if they fully understand that, then I will support them, because a lot of times they're going to do it anyway. And so I'll support them in making sure that we're getting still good nutrition in, and making sure that we're not losing weight and we're not getting ourselves into an unsafe scenario. And of course, so long as that physician is on board is of great importance as well.
Absolutely, yes. Well, that was our last question, Nicole. Thank you again for spending this afternoon with us.
Yes, you're so welcome. Thank you all for inviting me back.
Yes, we love having you. And thank you to all of our listeners for participating today. We want you to stay connected with our foundation, so visit us on our website, like us on Facebook, and both of those locations, you can stay up to date with us and what we're doing. There's Spring Survive and Thrive symposiums coming up, and just to throw those locations and dates out to you, we'll be in San Antonio on February 15th, and then in Austin on March 7th, and in Waco on April 27th. And so be looking out on our website and on our Facebook page for details for those to come out. And lastly, as we bring this webinar to a close, a survey is going to open up on your screen. Please just take a moment to provide us with feedback on today's presentation, as well as topics you would like to see covered in future webinars. So thank you all again. Thank you, Nicole, again, and we will end our webinar now.